This is the entire pharmaceutical sector. So let's bring on board Kewal Handa, the industry expert, to chat about how exactly is pharma going to pan out from here. Kewal, hi, morning. How is it that you see the noise coming in from the US? Trump's speech, do you see no concrete move has been taken, or would you say this is definitely going to have its set of implications on pricing of generics?
So I think the one thing that I take it very positively is for the Indian company, where he's saying that the approvals for generics companies will be made much faster. That simply means that he wants to reduce the cost of medications in US, and therefore he wants more generic approvals to be made. So that's a great opportunity for Indian companies. And you've seen some stocks of generic companies have actually gone up on that. The other thing that Trump did mention, which has some implications for MNCs working in India, is he said that there is no free ride now for anybody, and the other countries will have to pay the same price for the drug which is being paid by the patients in US. So this is a big implications, because what's happening today is that tier pricing takes place in underdeveloped countries and less developed countries. Now, whether this tier pricing goes up and there would be a common uniform global price, or how is he going to force the companies to have different prices? If you bring down to India, you see some of the companies have a very different pricing for their products than the US prices. And now what is going to be the implications for them? Are they going to raise the prices, or the new patent drugs are going to come at higher prices, or Trump is going to insist on patents very strongly? I think that's a big implication for MNCs operating outside US.
But what's the opportunity set for Indian generic pharma, which is kind of getting its act together with regards to meeting compliance of the US FDA? How big is the opportunity set on what's transpiring in the US for Indian pharma?
So the opportunity is very great, and in fact, if you see two things that's happening is trying to say that the fixing of prices also in US is going to take some measures, and also he's talking about clear approvals for generics, and there is the understatement which is already there that we want to increase the percentage of the generic products in the US market. Now, if I put all these three together, I think the Indian companies which saw a very slow growth in the last few years, and we saw it spade off F483 and closures of plants, will have to really tighten their belt and says, if we want to operate in the US market, it's a great opportunity. Let's focus on quality. Let's focus on availability of products, and you will get the price and margins.
But it's also going to be competition within emerging markets, right? Because there would be a cost benefit that comes in from sourcing generics here and the ANDA supplies. But it's not just going to be about India. We've seen how Mr. Warren Buffett has invested in an Israeli generic company in Teva. So it's going to be really the cost competitiveness across the region among emerging markets, and who can provide the most value propositioned supply to US patents or drugs coming off patents.
Oh, absolutely right. You made two valid statements. One is that you have to be cost effective in terms of being the lowest cost producer. B, you have to have a high quality. But the third point, which you made, very, very valid question, is it's not necessarily in the US market you are a winner because you have a low cost. You are a winner because you launch it early. You are a winner because you make the product available. You make the volumes available that is required. But we have seen Indian companies are suffering basically because of the availability challenge, not because of the cost challenge. And availability challenge comes in because of the notices they get on the plant. Availability challenges comes in because of raw material challenges coming from sources of raw materials that are not regularly available. Our dependence on API is very, very strong, based on API requirements coming from China. Now, if you have such a strong dependence on API and you don't have a control on your API, there is going to be a challenge on the availability. And this is something that the Indian companies have to sort it out. How do they make their ring fence the entire formulation through API as well as the formulation, having the best plants and availability regularly supplies? If they can do that, they can beat Tevas and Mylans. It's not a big deal.
Well, what about pricing pressure, Kewal? Do you believe that at least the pressure in the US has bottomed out, or do you think things could get worse from here?
I don't think so. Pricing is going to get worse.
Okay.
Pricing should be comfortably there, and the competition probably will get more, but it's not going to be a big challenge in the supply of products to US. Of course, if your ANDAs are such which are old, which are not complex, or which really are not in demand, probably you may have challenge selling those ANDAs. But otherwise, some of these ANDAs Indian companies are working. There is a good demand, and I'm sure that they will get good margins.
Right. Can you draw it down to specifics? Which of the Indian companies stand a better chance to compete in this sort of an environment where things could be looking up? Because, it's going to be a tough battle. So which companies do you think can hold ground?
I think companies like Sun, Lupin, Intas, Zydus, Dr. Reddy, they are all poised to compete with any one of those global companies. So I have absolutely no reason why we should be afraid of global competition. We should compete on our own strengths.
Okay. What about the R&D expense? Do you sense that in the longer term or in the medium term for that matter, the R&D spend is bound to show an uptake when it comes to both Indian as well as US companies?
So if you look at the R&D spend of the Indian companies, it's mainly on the A&Ds. And those spends in A&Ds have gone up from an average of, let's say, $1 million spent on the single A&D development. Today, they're spending almost about $2 million. And I'm seeing on a pipeline, they have at least 20 or 30 A&Ds on pipeline. So the A&D spend have gone up. But what I think Indian companies should be looking at is the supply of the API to give both the regular availability as well as the cost benefit. So there is where the investment perhaps might be looked into is tying up the API supplier or the API source, or looking at manufacturing these APIs to their A&As so that they are not not competent enough in the global markets.
Okay. It's interesting that you've highlighted that. Just one final question. How big can the generics opportunity be as, there is talk about most drugs coming off patent, and, in the US also there's a revolution of sorts coming through where healthcare costs need to be brought down. We've already heard how Mr. Warren Buffett, Mr. Jamie Dimon, as well as Jeff Bezos are coming together in ensuring that they can meet that objective. So in that light, can you put in a size to the opportunity set to the market then?
So I think the idea is that the new patented drugs which will go off in the next 5 years is in the range around about $30 to $40 billion or so. So the size is very, very, very large, and there are players. I'm not saying there's not going to be competition. There's going to be competition from also the e-supplies also to be made directly. So, but the fact that Indian companies do have a well-entrenched supply system, they have relationship, and their cost benefit, even today they are lowest cost. I think they should be able to get a good buy of the entire market, the US market, which is very attractive.
Thanks very much for joining us.